Hi, everyone. Welcome to week 9. Can't believe we are already on week 9. The weeks are just flying by. Wanted to give you some quick information and also and recap everyone on this past week where we really started to delve into some profession specific issues. So, as always, we'll start things off with a quick summary of this discussion from this past week. Fantastic job. I think you all did a really nice job taking this information, this advice that we're hearing from practitioners out there from different viewpoints of the healthcare team that were talking about advocacy issues. And you all went and researched and looked into these issues, and it resulted in some fantastic discussion. A lot of the discussion was really focused on reimbursement rates for physicians and for nurse practitioners and some of the differences there. As we have discussed and as we've heard from some of our different expert interviewers, it's really important for us to think about really that business structure underneath our healthcare professionals and how that can result in differences and things like access to care. So I'm glad you all picked up on that and spent some time discussing it. Um, there was also a lot of support for childcare or elder care for healthcare professionals and some of the internal dilemma that some of the medical students may have about putting their job first above having a family. And I think that's a pretty common theme that we hear from a lot of the different members of the healthcare team as well. There was a lot of discussion on primary care and provider status for different healthcare professionals, including nurse practitioners, physician assistants, and pharmacists as well. So I thought that was fantastic and really hits back to a lot of our common themes that we've been discussing throughout this course. And I wanted to highlight Kelvin here for a moment because I just really liked and this really resonated as the purpose of this week. And I wanted to highlight this post as he was summarizing Dr. Alston's advice that instead of seeing each other as just a doctor or just a pharmacist, we need to look at what each health profession brings to the table. We all need to work as a team to make sure the patient gets the best quality of health. And that is exactly what I was hoping that we would get out of this week as we hear from these healthcare professionals. So it just makes me really happy that we're having this fantastic discussion and seeing the value that each member of the healthcare team brings to the care that we're providing to our patients. So this next week, we're going to continue to investigate and hear from different members of the healthcare team. And I'll turn things over to Dr. Rodas to really talk to us about what we'll be doing here in week 9.
Okay, excellent. Thank you, Dr. So I will build and reiterate for, the third or fourth time after Dr. Alston said it. Kelvin highlighted it, Dr. Murphy said it, and I'll say it now again. As we go into this week, you'll hear from 4 more professionals in different areas of expertise. So someone who talks about dentistry, optometry, oh, here it is, social work, and also physician assistant. So as you approach these, as I've watched through these videos, each person was asked to come forth with a video about what they do. And so they're coming to tell you, here's how I train, here's what our struggles are, here's what our expertise is. And what I read in some of the reflections and some of the posts last week was, highlighting specific issues that arise in individual professions. And I read a few judgments too around what you guys individually think about scope of practice, about what different folks should be doing. And I encourage you to delve into that and keep in mind that reiteration of the fact that what we hope you take away from these videos, and we really want you to ponder and reflect upon, is what are the distinct roles each person brings to that team. If we think about a patient at the center and we build around that patient, each one of these professionals that you've heard from last week and this week, think about what each of them could bring distinctly to enhance that patient's care. And, for all of you, some of you are thinking about a healthcare profession, some of you already know which direction you're going. And so one of these, you might be like, oh, yes, that's what I want to do. And I totally relate to their perspective because of that. But really step back and think broadly about, how might I feel if I was a someone going into optometry or dentistry or social work? And what could this team look like if we're really leveraging the top strengths of every one of these professionals? And I look forward very much so to reading what you guys come up with as you go into these next professions. We'll do again a discussion post. So research and advocacy issue related to one of the professions this week. Put your first post in by Friday and your peer response by Sunday. And we will finish with this quote from Helen Keller, which is really quite a good one, and I think helps emphasize the key point of team-based care. Alone, we can do so little. Together, we can do so much. Enjoy the week, take care, and we will talk to you again next week.